Hello, my name is Praz Murthy, CFO and co-founder at Dr. Multimedia. First and foremost, I want to extend our thoughts and prayers to all of our clients and their families that are affected by the current national health emergency. But I also want to communicate with all of our clients what we've been up to over the last couple of days and how this unique time can help transform your practice in some ways that you may not have anticipated, but may be really important in helping serve your local communities. Here at Dr. Multimedia, we did not send you an email over the last couple of days telling you how we're wiping everything down more often. What we actually have been up to is researching all the different options available to our clients in terms of telemedicine, live chat, client communication, and bracing for the likely inevitable reality of a lot of Americans working from home, like myself, staffs being unable to show up at work but still willing to help, and I think most importantly, patients and clients that need help or advice or consultations that can't get them over the coming weeks. So, as a culmination of the last 72 hours of research, we are now finally ready to recommend to all of our clients what we're describing as a telemedicine package. The goal here is multifold, which I'll explain, but in short, the world has changed dramatically. The fact that you're watching this video through an email and is maybe the only human interaction that I have today kind of explains just how quickly things are changing. But in this dynamic, your website, your digital presence, your digital marketing is actually the one area that has not changed and where you can still reach out to your clientele, to your patients, and they are no doubt coming to you looking for updated information and guidance as well in what is a scary time for many people with health conditions. We certainly can see that. We've received thousands of requests over the last couple of days to update websites and update them again, and try to keep patients informed, especially as things change by the day, by the hour, depending on your location. The other unique vantage point we have at Dr. Multimedia is that we have clients all over the country, from the most affected areas to the least affected. And so we do have the benefit of watching what happens, how things unfold, and what that means for our clients. And odds are, if someone in Washington State is going through something right now, that there are other people around the country that will be going through that exact same scenario in 1 or 2 or 3 weeks, or however long this unfolds. So the reason for the video today is I do want to make you aware of some options to you and your practice as everything else seems to be changing. Whether you're a dentist that just got a letter saying that you need to close your practice, whether you're a veterinarian that's been instituting curbside check-in, whether you are an orthodontist that has consults and you're not sure whether or not these children should be coming to you or not coming to you or what's going on. Everybody has more questions than answers right now. And in times of a national emergency, what most people want are guidance, strategies, plans, and obviously some reassurances that things are going to be okay. I know every business owner, including myself, has worries as to what things will look like over the coming weeks and months, and what that means for our staffs, our employees, etc. As you can tell, we are blessed enough to be able to work from home, and so in case you're wondering, the entire staff at Dr. Multimedia it was announced to work from home as early as last Thursday, so we've certainly been ahead of this and had some time to plan. Okay, so a couple of telemedicine options for you and why they're so important. I'll start with the simplest one, which is live chat on the website. As you no doubt know, the further this drags on, the more the phone lines get inundated with simple questions, complex questions, patients, non-patients, really everything you can imagine is probably happening on your phone lines. So, while in normal times, when you have a busy staff and people are running around, the idea of live chat on a website isn't appealing because nobody's going to be checking it. In a time like this, it's a crucial added level of communication. Our own live chat on our website has seen an incredible increase in use over time because people are trying to get information to us quickly while they're juggling other things. This is most relevant if you do have to have staff working from home, whether by state mandate or just because they're an at-risk population and it's not a good idea for them to be in the practice. If you do have employees at home that are on your payroll, that is an expense that you're not able to cut now or don't want to cut, they have the unique ability to actually man and work a chatbot on the website where they can help triage the incoming questions and also direct people accordingly as to whether or not they should call or whether or not they should come in, or even just give them some basic advice. So first and foremost, as a component of one new level of communication, if you have either slower staff in the practice, or you're contemplating having staff members work at home, or you're forced to have staff members work at home, the beauty of live chat is that they can share the responsibility. They can all have the usernames. They can all have the passwords. I have 5 or 6 employees at Dr. Multimedia. They get notified when a chat comes in, and whoever is able to take it can take it and then guide the client, or in your case, the patient, accordingly. The next, more significant part of a telemedicine package is video consults. So we spent the weekend, as I mentioned, evaluating platforms, determining what was going to be the best fit for the largest number of clients, and we have identified a video consultation platform that can accept payments, and we are calling all of our clients right now and making sure they're aware of the option and that we can handle it from start to finish if this is something that they want to consider. The idea is a fewfold. One, you're a doctor. We're in a national health emergency. We know that everybody wants to do their part to help out not only their patients, but other people's patients as well. And in a time like this, patients have a lot of questions, and not all of them require an in-person visit. 2, a lot of you are having to close or slow your practices, which does leave you with more time. Even if you're the only one left at the practice for emergencies, you do have time, and you do have knowledge, and you do have resources that could help your community, and opening yourself up to video consultations gives people a way to reach you. And lastly, no matter what your specialty, you are still a doctor and you still have valuable medical opinions and advice that the public would want at this time, even if it's your current patients. Advising them or guiding them to what they're dealing with has a lot of value. So if you're in a position where adding video consultation to the website as a tool that allows people to, of course, check in, and don't worry, it's HIPAA compliant, and there's payment security, and all of those features have already built in. We're already have curated for that. What we are now able to offer our clients is the ability to add live chat and telemedicine video consults with payment to their websites to give them 2 new forms of communication. And I just want to explain that even if this isn't preferred, having these options will provide great flexibility to your practice over time. You know, I think the people most affected right now are dentists that are closing, whether by state mandate or not, except for emergency cases. We've been getting these requests constantly. We're going to be open, but we want to defer elective procedures. We're here for emergencies or urgent care. That's what we want our patients to know. Well, if you do that, the inevitable next question that every patient or client has is, am I in an emergency situation? Do I need to come in? Should I be in the car and driving? Can I wait this out a couple of hours? Should I come in tomorrow? Those fears are only exacerbated at a time like this. So having the ability to triage, whether it's taking the live chat request and asking them to start a video consult, whether it's just asking them to have a video consult, gives you, the medical professional, the ability to at least sort and prioritize and make yourself available, where you can say things like, okay, follow these recommendations. If nothing changes over the next 3 hours, go ahead and come in. Or you need to come in immediately. Or you know what, this looks pretty standard. You can come in tomorrow or Friday or a day when you have coverage to watch your kids at home, and provide that flexibility. So if you are interested, and I want to stress, only if you are interested, this is a public service announcement for our clients, and we know it's just a matter of time before different areas face different realities. But if you're interested in having these tools equipped to your website, contact us, click the button below, and indicate that you'd like to move forward. I'm sure my team is reaching out to you right now, trying to get a hold of you to make you aware of these options. But we firmly believe that this will best situate your practice for what lays ahead. And unfortunately, none of us know exactly what's coming, but based on projections, based on what the most affected areas are going through, it seems clear that we are bracing ourselves for anywhere from 1 to 2 months of people being at home, work being disrupted, but obviously medical conditions endure. Whether it's a consultation, whether it's guidance, whether it's nutritional information, whether it's post-op instructions, even just your current patients, as they get relegated to their homes, are going to have a lot of questions. And you're going to have, presumably, more time on your hands to help if you can only find a way to connect with them. And we strongly encourage that you do this through an established platform, not just for security and HIPAA, but to collect payment. I know at a time like this, no one really wants to talk about charging people or having to incur extra cost. But the truth is, if you just open yourself up as a toll-free line, you'll be inundated with requests and questions that aren't appropriate and actually waste your time and limit your ability to serve the rest of your community. Once you have these tools in place, you then can promote them, of course, at a time where it's very hard to promote any of your traditional services. Curbside check-in is a term that's increasing on Google searches with incredible speed, and a lot of clients are offering it, but they aren't able to make their clients aware of the option or the instructions. Telemedicine is obviously booming right now. Those that have already used it for years know that this is just a time for it to augment their practice, but those that haven't used it in the past, this presents a unique opportunity to see how can you stay connected. And just like we're not sending you a text-based email with updates, you get to see me, you get to hear me, you get to listen to what we're proposing. Something like this for your patients can go a long way. And if you are able to monetize that, and depending on your state, there are insurance rules for reimbursements for telemedicine appointments, and obviously we're dealing with a health emergency where a lot of normal regulations are being lifted or being amended. It is the perfect time to stay connected to your clients and your patients, remain the doctor and the voice of medical advice, and guide your loyal patients and clients through this time in a way that still allows your business to function and grow and to make use of the amazing staff that you have that unfortunately will become more and more limited by their own capacity and things they can't control. So again, if you'd like to hear more about this, just let us know. We'll be happy to reach out. If you're ready to go ahead and add it to the website, go ahead and just contact us through the methods below. We'll get it all set up. We handle everything from start to finish, turn it over to you. And as the days and hours and weeks unfold, we're also here to help support, share the stories of how it's being used successfully, and help you guys in every way that we can continue to maintain your practice. The simple truth is these tools exist in medicine. They're going to be used, and for practices that practices that close and can't take care of their patients, the patients will look to what options they have to get care, even if that's another practice. So for those of you that are desperate to think about what you can do and how you can help your constituency at this time, these are the two top ways we have at the moment. As new ways develop, we'll be sure to let you know, but we're strongly encouraging all of our clients to consider adding a telemedicine package of live chat and paid video consults to their website, to their web presence, and then allow us to help you get more people on there. So again, from everyone here at Dr. Multimedia, we want to send our thoughts and prayers to those affected directly and indirectly by the current situation. Know that we are still open, we are still fully staffed, we're here for everything that you need. And I think the biggest thing that we can provide you is advice and guidance from what's happening with our clients all around the country and how you can use this unique time to make changes in your practice to actually make you bigger and stronger as a business. If this extends for months at a time, like some people are projecting, even after this blows over, telemedicine might become a regular way of life for the American public that got used to it and wants to limit further exposure when visits aren't necessary. So it is also, looking ahead for business owners, a component that if you can capitalize on now and figure out how to make it work, it's something that you could continue to offer even after, the worst is behind us. So thanks again for your time. We'll send out as many video updates as we can as this evolving situation continues, and we're most excited to share with you strategies and techniques to help your business and your practice stay afloat while also caring for your patients through this whole national health emergency. If we can help you in any way, please reach out to us, 1-800-679-3309, 1-800-679-3309. Email us at help@drmultimedia.com. Reply to this email if need be, or click the buttons below to progress down the next steps so we can share with you the diligent work we've been doing to help your practice. Thanks again. Have a great day and stay safe.